So at the onset of the new session, I would like to welcome our chairpersons and our speaker. I would like to say something about our chairpersons and introduce them. They are Professor Alak Kumar Singh, HPTU Kanpur, and Dr. B.P. Priyadarshi, Associate Professor and Head of the Department of Medicine, Government Medical College, Kannauj. Sir, please take your chair, and thank you so much for chairing the session for today. And I would like to welcome our esteemed speaker from far, far away. Thank you for being here, Dr. Srishti Ramasha. Dr. Srishti is from the Department of Health Sciences and ANDI Center of Excellence for Biomedical and Biomaterials Research, University of Mauritius. So we are all awaiting your comprehensive talk, and I would say this nutraceutical topic for today is very interesting, and we are all looking for alternative medicines and alternative ways of treating such a challenging task, which it is today for cancer prevention. So without much delay, I would like to invite Dr. Srishti Ramasha.
Good morning, Kanpur. It's really amazing to see the stand you have taken, and it couldn't have been a better morning. So you've been hearing a lot about cancer statistics yesterday, so I wouldn't get into the details of that. And what I would like to highlight is that it is increasing at such an alarming rate that if we don't stem this current tide, by 2030 there'll be an increase of 75% global cancer cases. So in this perspective, what I would like to say is it's a bit more easier to work on the prevention front rather than the curative front. So in this vein, I would like to present my work that I have been doing, and I would like to thank the organizers for giving me this platform today. Thank you so much. So I know after 25 minutes people usually tune off, so I'll keep it very focused. So mushrooms are a treasure trove of so many compounds. So from a nutritional perspective, they're very high in proteins, low in fats and calories, and relatively rich in certain vitamins, and have elevated levels of phosphorus, potassium, and magnesium. So the major phenolic class compounds, so these are kind of secondary metabolites that are produced in mushrooms, have been identified as phenolic acids and flavonoids. Moreover, recently we have seen that ergothioneine, it is a very powerful antioxidant. Antioxidants are basically those that scavenge ROS in our body and help in the endogenous antioxidant and enzymatic system in our body. So overall, we have several mushrooms have been characterized with anti-tumor, antibacterial, and antifungal properties, thus promoting them as potential functional foods. So where do we stand in terms of research today? All right, there's a small problem. Yes, so in terms of I need technical help. Okay, there's some problem. But what we are doing today is there is a lot of research being done on medicinal mushrooms like Ganoderma, lucidium. So what we have seen is in clinical trials with cancer patients, they complement chemotherapy and radiation therapy by counteracting the side effects, for example, nausea, bone marrow suppression, anemia, and lowered resistance. And however, what we have seen is edible mushrooms is gaining a lot of popularity, mostly because of their long history of consumption with humans and low toxicity. So what we have seen is that proteoglycans derived from fruiting bodies of Lotus oestratus, they have immunomodulating properties and anti-tumor properties. So research so far has been focused on cell cultures and animal work, where we have seen that a significant regression of inoculated tumors in selected murine models, mice models. So most of the common edible mushrooms and the work that has been done on cancer is agaricus species and Pleurotus species, which have been highly researched. And as I mentioned earlier, in comparison to medicinal mushrooms, clinical trials on edible ones are very few. They are mostly as an immune booster. So these mushrooms have been tested in several cancer cell lines, and we have an array of compounds, anti-cancer compounds, that have been identified in these mushroom species. So in this perspective, what we did was, I would like to mention that mushrooms were not native to Mauritius. They have been introduced and have been in cultivation for a number of years. And what is interesting is the formation of these secondary metabolites in mushrooms is affected by several factors. So each country is not necessary that the species from each country will be the same. So what we did was we did the HPLC analysis to identify the potential bioactive compounds in these species. And we also tested the effect in a hepatocarcinogenic biopsy mice model, where we tested a number of parameters, hematological, biochemical parameters. And the first step towards identification of a possible mechanism was also studied, like how do they prevent the alteration of DNA bases and backbone structure with different treatment groups using laser Raman spectroscopy. So these are the mushroom species from Mauritius, and what's interesting is, along with the Pleurotus sajocaju, which is quite famous, Mauritius is also developing Pleurotus hybrids. So they have been coded as CC201, CC200. So from the look of it, you would say this is poisonous and shouldn't be eaten, but that's not the case. So what's from the same family, now we're trying to see how these mushrooms will be different at species level. So what we harvested the maturity stage, and we did the exhaustive extraction, and we did the phytophenolic analysis. And just as I mentioned earlier, we used biopsy mice. We had the control group and the carcinogen treated group. So N-nitrosourea is a mutagen that has been shown causes liver cancer. That was established by publications with Dr. Shalini Verma from CSGMU. So we had 5 treatment groups. Same concentration, so MNU was administered IP, and we gave the extracts orally. And just to mention, it was not mixed in the food, it was given by a cannula. So we took the blood samples for hematological analysis and biochemical analysis, and the mice DNA was further examined by laser Raman spectroscopy. So what we have seen in the phenolic profile, it ranged from 33 to 100 mg per gram dry weight. And as I mentioned earlier, negligible proanthocyanidins, but very good levels of phenolics and flavonoids. So the major compounds identified were gallic acid, protocatechuic acid, pyrogallol, and as I mentioned, ergothanin. So that was one very good thing. They were present in significant amounts. And if you see these bioactive compounds, they have already been credited with lots of anti-cancer activities in several cell culture models, cancer cell models. And there's some research in terms of cancer cell invasion and metastasis. We have also seen that protocatechuic acid from agaricus species were very effective. So the results of our study, what we see is that carcinogen-treated mice showed a decline of 15.2%. And so that's the lower part, the red graph, the red bar. And the extract-treated group showed a better growth than the carcinogen mice. We also noticed that the weight increase of the mice supplemented with agaricus was closer to the normal mice. So liver body weight is actually a very good indicator of tumor presence. So as you can see, the carcinogen-treated group showed a 2.8-fold increase in liver body weight, whereas for the other groups, they were more or less within the same range as the normal mice. So in the normal mice, you can see smooth and even growth of hairs in normal mice, a healthy liver, normal architecture. While in the MNU-treated mice, there's a patchy skin, uneven shedding of hairs, and with the H&E staining, we can see that the nucleocytoplasmic ratio, the cells are appearing very leaky, and large vacuolated hepatocytes and altered cell structure. In these, when these mice were given simultaneously carcinogen and extract supplementation, we can see that there is a extract protective effect. Visually, there is a reduction in hair loss and reduction in lesions, and also the cell architecture almost comparative to the normal mice. So in the biochemical analysis, what was very interesting was for agaricus, normally you would have a tendency of thinking that if you increase the dose of something, so it doesn't necessarily have a better effect. So that was a kind of a Janus effect that we noticed, that identifying a particular dose is very important, because at higher concentration it might have deleterious effects as well. So the carcinogen-treated mice showed reduced endogenous antioxidant activity with an elevated lipid peroxidation, and we have seen that prolonged exposure to potent carcinogens show a decreased enzyme activity in targeted tissues of organ-specific carcinogenesis. And extract treatment improved the antioxidant defense and also reduced lipid peroxidation to significant levels. And the most recent findings from an author, Wang, in 2017 showed that extract treatment in carbon tetrachloride-induced hepatic damage in murine models also shows an upregulation of antioxidant defense system with extract treatment. In the hematological analysis, we found that there was an abnormal profile with the hemoglobin concentration 31% lower than the control group. Leukocyte counts were within normal range except for the carcinogen-treated mice, and we had significantly high levels of eosinophils, monocytes, and red blood cell count. And even in this case, these extracts modulated the integrity of whole blood, including all these parameters that were tested. And in Raman spectroscopy, so as I mentioned, MNU, how does it act? It's an alkylating agent that reacts with nucleophilic nitrogen and oxygen atoms and bases and DNA phosphate groups to create lesions. And when you're continuously exposed to MNU, which is normally found from tobacco smoke, pollutants in the environment, and especially those foods which are preserved with nitrates, be very careful with those. There is an increased formation and repair and persistence of DNA adducts, which eventually leads to inflammation and elevated levels of inflammatory cytokines, creating a very conducive environment of survival and development of cancer cells. So that's the profile of a normal mice. I would like to mention that the region 1200 to 1600 is prone to alkylation by MNU. Alkylation here was noticed at the peak of 1254. There was a strong interaction, and overall the peaks were higher. And this intense peak was normalized and not apparent in any of the mushroom-treated DNA samples. So to mention that the most effective concentration for Pleurotus species was 300 mg per kg body weight, and for Agaricus was 450 mg per kg body weight. So overall, I'll summarize. The anticancer properties of these two species have been seen in terms of reducing oxidative stress, tumorigenesis, while also promoting immunomodulatory activity and also restoring near normal growth. So with the rising incidence of cancer, there's a hunt for functional foods rich in antioxidants that may provide an alternative approach to disease control. So in this study, it's highly demonstrative that these species are liable to modulate hepatocarcinogenesis in biopsy mice. Remains to be tested in clinical trials. And since carcinogenesis is a multiple process and often progresses slowly in the early stages, there is a better potential and efficacy of these agents for suppressing the development at an earlier stage. These extracts with modulatory effects on these parameters could therefore provide efficient points of intervention at early cancer stages. Because what happens is, at that point, molecular aberrations are lower compared to advanced stages. So what are the prospects that we have come so far and what we are doing in Mauritius is, so we have done the phytochemical analysis and antioxidant potency. We have seen the in vitro cancer effects in cell lines like breast, hepatocellular carcinoma, and liposarcoma. As I mentioned, the study was very specific about in vivo hepatoprotective effects. And recently what we're doing is we are now identifying the molecular mechanisms of how these mushrooms are acting. So what we are doing is we are seeing how they're involved with apoptosis and certain signaling pathways in HepG2 cells, human hepatocellular carcinoma cell lines. So what we've seen is that there is a modulation of inflammatory cytokines where they upregulate anti-inflammatory cytokines and reduce pro-inflammatory cytokines. We've also carried out, tested for certain markers that are involved in apoptosis, and we have found very significant results where the BCL2 family proteins have been shown significant modulation with increase in BCL2 and increase in BAX production and PARP cleavage. What we've done is we should have the right balance with genotoxicity and also because genotoxicants also affect cancers and normal cells alike in certain cases. So in the genotoxic effects, when we studied these, we found that compared to hydrogen peroxide, which produces very long tails, you can see that there's damage, and these extracts were mildly genotoxicant. And we are currently leading towards more comprehensive scientific data on Mauritian mushrooms for potential applications in future clinical trials. And that's about it. And I would like to thank Professor Ashok Kumar and Dr. Shalini Verma, without whom this work wouldn't have been possible. Funding for research work from the Mauritius Research Council, CSGMU, and specifically Dr. Varsha Gupta from IPSBT and Professor Ranjan Kumar for providing the facilities for Raman spectroscopy. And that's about it. That's our unit. And I would like to mention that the ANDI research is comprised of two units. We have the biopharmaceutical unit, and we also have the chemistry unit where they are working on nano drug delivery. So currently they are doing that with drugs already on the market, and the future prospect is we are going to try that with natural extracts. And thank you for your attention. So I would like, with this talk, the purpose was that Mauritius, if you see, is a population of 1.3 million. And on the world map, it's like pea size, it's a dot. And India, we are trying to valorize our natural extracts in the country. And India is such a rich country with so much of resources. So I would like to prompt research in this direction. Like we have heard so far what we should not eat, but I also think that along what we should not do, we should also promote what we should be doing. So I hope that the research in India regarding natural extracts with the anti-cancer properties will take another dimension with possible clinical trials. Thank you for your attention.
इसके बाद लंच है और लंच के बाद टॉक 3 PM पे स्टार्ट होगी। टॉपिक है इनहिबिटर ऑफ एपोप्टोसिस इन ब्रेस्ट कैंसर। स्पीकर इज प्रोफेसर मनोज पांडे, और हम वेलकम करते हैं प्रोफेसर मनोज पांडे का। वो IMS BHU से आए हैं टॉक लेने के लिए। 3 बजे ये टॉक होगी और 3 बजे से ही टॉक स्टार्ट है यूनिवर्सिटी इंस्टीट्यूट ऑफ हेल्थ साइंसेस में, हॉल नंबर 1 में। टॉपिक इज रिसेंट ट्रेंड्स ऑफ फिजियोथेरेपी इन टर्शरी केयर इन ऑन्कोलॉजी। स्पीकर इज डॉक्टर संजय कुमार झा। 2 टॉक इंस्टीट्यूट ऑफ हेल्थ साइंसेस में है, 3 PM और 4 PM पे। 4 PM पे टॉक है रोल ऑफ एक्सरसाइज इन कैंसर। ये दोनों टॉक इंस्टीट्यूट ऑफ हेल्थ साइंसेस में है। ऑडिटोरियम में 3 PM पे इनहिबिटर ऑफ एपोप्टोसिस इन ब्रेस्ट कैंसर, और 4 PM पे 2 टॉक हैं, थेरेप्यूटिक रोल ऑफ मेसेंकाइमल स्टेम सेल्स इन लंग इंजरी एंड इवैल्यूएशन ऑफ साइटोजेनेटिक डैमेज इंड्यूस्ड बाय लैंडफिल। इसके अलावा पेपर प्रेजेंट